about 5 questions at once. I could try it. I can thread them all into one if you like, but right, we'll go over here first. Bridget.
Some doctors say there's too many exemptions for masks, and they've had a run-in of people with asthma contact them for exemptions, even though it's controlled. What's your message to those people?
Now, I've got a couple of asthmatics in my house. They're all wearing masks. That's not to say every asthmatic is the same. I think that people need to engage in this in the best spirit. So we have seen some reports of people selling masks for toddlers and babies. That is simply not on. Toddlers should not be wearing masks. Kids 12 and up should be, but under that age they're not required to, and babies and toddlers should not be wearing masks. Do not buy those products, do not use those products. Well, there'll always be a debate, and it's not an unhealthy thing. Whenever you grant exemptions, whenever you draw a line, and there are groups on either side of it, I think we've got that balance right. If at some point we need to change that, if people were using exemptions to undermine the integrity of the overall system, which hopefully we want, the vast majority of people, when they're out for a lawful reason, when they need to be out, are wearing a mask. The supermarket is a fantastic example. That's just exactly the sort of setting where wearing masks will be critically important.
At St Basil's, how many residents have been diagnosed with COVID-19 and how many staff?
Sure.
Do we know how the outbreak started?
All of that can be contained in the show media release later in the day, and if there's a follow-up we need to give you, we will. It's not just about positive cases though. There'll be a bunch of staff who will be close contacts as well. They may never get it, but they have to be away from work, and when you take an entire workforce out of a facility like that, that's where a second workforce is very important, which I think was the original question.
So we'll see a lot more federal authorities stepping in aged
Well,
care.
I would say, well, how you want to term it is a matter for you. This is a sector that's regulated, funded and run by the Commonwealth. This is private sector, for-profit and some church and charitable aged care. This is not the 180-odd public sector aged care facilities that we run. They're run as part of health networks. They're in a different place. But it's not about who's responsible for what. We're all in this together, and we're working really closely. And again, it was a feature of my discussion with the Prime Minister last night. That plan will work in pulling it up in aged care settings. But those numbers I spoke to before, the number of people who are sick but not getting tested, then tested but not waiting for their results at home but instead going to work, a bunch of those will be aged care workers. Let's not judge them. Let's try and work out what's driving it. And I think that financial hardship and insecurity of work is a really big factor in it, and that's why the payment and perhaps some tweaks, some additional announcements I'll make very soon will be an important part of that.
You got people who shouldn't be wearing masks?
Yes, certainly.
Yes. What did you make of claims on the 7:30 report last night from a security guard who claimed she was recruited from WhatsApp and not given any training?
I didn't see 7:30 report last night, but I have seen a report of that program. What I'd say to you is we've got a retired judge, counsel assisting, a strong budget and very broad terms of reference to deal with all of those matters and many more. And it's not my intention to be cutting across that in any way. What I made of it is that there's a need for a judicial inquiry. That's why I've set one up.
Last questions, please.
Any more for me or Jenny?
Can I ask you about community sport?
Yes.
How much money can the government keep pouring into local community sporting groups, and how important is it to keep them alive through this pandemic?
Well, there has been some assistance. I'd have to get an update from you. I'll fully confess that that's not been at the top of my list. I know it's important, it's very important, and it is functioning in regional Victoria to a certain extent, not so much in metropolitan Melbourne and Mitchell Shire, and that's very painful for a lot of people, not just as a leader but as a parent. In our own household there are sporting activities that would have been going on this winter that aren't, and that just brings it home for you that it's not just a line in a brief. It's not just notional. It really is. It's really impacting people across the board. I've spoken with, for instance, with John Wiley at length as the head of the Australian Sports Commission. There are a number of smaller sporting codes and bodies at a state level that without membership income. And of course, if you're not playing, there's every reason to suspect that people won't pay their subs. Also, a time of economic hardship, maybe people don't have the financial wherewithal to pay those subs. We'll need to do more here. We have done some things. I'm happy to get you an update on exactly what we've done. I haven't got I can't quite find the figure at the moment, but I'll come back to you about that. But it's a significant issue because it's about keeping communities together. It's about keeping people healthy and fit and well, and it's a sense of normality, but it's not conducive with stopping the spread of the virus at the moment.
Just on the pay rise public servants have received, why is it appropriate for them to receive a 2% pay rise in the middle of the pandemic when they're...
Well, we negotiate in good faith, Samaya. We negotiate in accordance with the government's wages policy. This deal, this agreement is out for the consideration of relevant workers. The union goes out for a ballot. We'll have to wait and see what their view of it is.
Most other jurisdictions, including your Labor counterparts in Queensland, have imposed wage freezes on the public sector workforce. In a situation where a lot of private sector workers don't have jobs at all or are facing, losses of businesses, wouldn't that be a sensible move to freeze wages?
I've got no such announcement to make, and what other states do is entirely a matter for them.
And how will you be paying the pay rises? Will you borrow the money, or has it...
No, we'll deliver a budget at the end of the year, and the accounts of the state will be there, clearly understood by everybody at that point. We have had a very significant revenue write-down. That's logical. We've got significant expenses that relate directly to the pandemic. We have been urged by some people, or at least one person, to run a budget surplus, and we've been criticised for not doing that. The sort of cuts you'd need to make to hospitals and schools and to our pandemic response, if you were to try and do that, would make no sense at all. The Governor of the Reserve Bank has been very clear with us. We need to build and we need to invest, and we need to be perhaps more focused on household budgets than we are on immediate repair of the state budget. We'll deliver a budget at the end of the year. The Commonwealth Treasurer, I think, has made it very clear that they're borrowing to get to the other side of this. All states and territories, in fact, all nations around the world are doing just that. But in terms of the specifics of any measure, all of that will be brought to book when the budget is handed down by the Treasurer. And that'll outline not only how we've paid for the things we've had to do, but it'll also outline our plan for jobs, for strength, for the recovery that we are all committed to making sure we can enjoy.
How do you feel this morning with the 484 number?
Oh, look, it's not about how I feel. Every day is another challenge. Every day is the beginning of a lot of hard work. And that's not just me, that's the team that I lead. This is thousands and thousands of people working day and night, doing their very best. Nothing is ever perfect. Nothing about this virus, this pandemic is perfect. It's very challenging, but I'm proud of them and they're working very hard. And Raph, I simply got up and acknowledged that today would be another hard-working day. That's pretty much the story of 2020.
To clarify regarding the pay rises, so Victoria will most likely need to borrow money.
No, that's not what I said at all. No, what I said to you, sorry? What I said was that rather than giving you a line-by-line accounting of every expense across the entire public sector, we deliver a budget each year. We will do that later in the year, and that's where those sorts of issues can be canvassed in the proper context of seeing all the accounts of the state, all the revenue, all the expenditure, and all of our priorities to get us to the other side of this and to make sure that jobs and skills and prosperity and recovery are at the centre of everything that we do, just as it has been for these last 5.5 years.
Just on aged care,
Certainly.
will you be moving all sick residents into hospitals now, or considering doing that?
That's done on a case-by-case basis.
Will you be changing it that all sick patients...
No, it'll continue to be done on a case-by-case.
Why won't you consider changing it?
Because it's done on a case-by-case basis based on medical advice. For me to stand at this podium and say, right, we're going to move everybody out, not because of a medical opinion, but because I think that's a good thing to do, that doesn't make any sense. We'll wait and see on an individual case-by-case basis. I've got some experience in a previous life about these matters. Moving frail aged people out of nursing homes is not a good thing to do unless you absolutely have to.